Hello and welcome to Talking Work and Health, the podcast series exploring contemporary issues in workplace health. With me, Liam Sloan.
And me, Dr. Mark Simpson.
When we first started planning this podcast at the end of 2019, we thought that pandemics would be a really interesting subject to explore. Well, here we are in 2020, and there could hardly be a more topical issue to discuss. As we speak, cases of coronavirus, COVID-19, are growing across the UK, and the outbreak that started on New Year's Eve has been declared a public health emergency by the World Health Organization. We've seen businesses struggling to know how to respond, and increasing concern among employees about what they should be doing and what might happen next. And in an increasingly interconnected economy, every country, every sector, every business faces risks. Where are we today? Well, agriculture and shipping are disrupted, travel and tourism has dried up, factory output in China has fallen off a cliff. So much so, I believe that air quality is better than ever in parts of China. And that, of course, has a knock-on effect on global supply chains, with Western firms struggling to import, major events cancelled or postponed, and so from big tech to banking to high street retail, businesses are facing serious disruption as a result of the outbreak. And it seems that there is another very 21st century risk: misinformation. The coronavirus has been dubbed the first true infodemic, due to the torrent of misleading information about the disease circulating online. Official health advice competes with conspiracy theories on social media, fake cures for sale online, and false claims about how the virus is transmitted. So maybe fake news could prove as deadly as the virus itself. So, how can HR professionals help their businesses deal with pandemics and health emergencies? Here to discuss this topic is my co-host, Dr. Mark Simpson, consultant occupational health physician, who has been advising CEOs and HR directors on how they should respond to the current outbreak. So, Mark, just to kick off today, can you give a couple of examples, perhaps, of businesses that you're supporting currently around COVID-19?
Thank you for that introduction. I feel I've briefed you much too well, as you've stolen most of my thunder in your introductory piece. But nevertheless, thank you for that. And we can certainly explore some of those issues in a little bit more depth as we go through this podcast. A couple of examples, and I think what they just illustrate, these two examples, are the different time trajectories and the lag as it actually impacts on a global basis. So the first one was an international retailer. A huge amount of its high worth goods were actually sold in China. Yeah. So Chinese market, enormously important for it. Also having some manufacturing capability in the Philippines and Taiwan as well, but not the major manufacturing capability. So what have they seen? They've seen that they've had to actually close 2/3 of their high-end stores.
Wow.
And China was their biggest single market dependency. Apart from that, they've actually had significant risk because obviously they had large numbers of people travelling really throughout China. And somewhere like Wuhan, with the population there, was a significant sales centre for them. So they had to close 2/3, really quite a disastrous impact. Unfortunately for them, their main manufacturer of their high-end leather goods was in northern Italy.
Aha.
So just when things were beginning to improve, they've taken a second hit. Obviously, as well, apart from that, the greatest concern is that they had large numbers of people in design and manufacture travelling constantly between the UK and Italy. So it brings really the threat of actual infection, importing infection, very realistically. So I think you can see from that example where they've actually taken a two-phase hit, really, and they've just been really unfortunate on that. Having said that, they're one of the best prepared organisations that I've actually come across. They've taken a very sensible, very pragmatic view. The other example is a shorter one. It's a major manufacturer. And I think the key thing is it's UK-based. They felt the effects of the coronavirus long before it ever got near the shores of the UK. Why is that? Since SARS, since swine flu, global supply lines and supply chains have become so intertwined and so complex that for this manufacturer, even to miss one component of the multitude of components that went together into their product brings the whole thing to a halt. So they were highly dependent on China, and so even before it began here, they faced the prospect of laying 35 to 40,000 people off work.
So you've got a supply issue. You've also, in the first example, you've got a huge demand issue, and that's going to just hit the bottom line really hard and just basic cash flow. I suppose one thing which has occurred to me during this outbreak as well is smaller businesses, SMEs, where obviously there's a much greater focus on cash flow and much less ability to withstand major crises. Is there a lot of disruption there that you're seeing?
I think what we're really seeing in again, this has been reflective of the growth in the gig economy. So at least for most people with larger or medium employers, there is some safety net from sick pay and other arrangements. Obviously, the people in the gig economy are entirely exposed if they're not at work, if they're on a 0 hours contract. So I think from individual circumstances, exactly as you go down, if you like, the chain from multinational organisations down to large national organisations to SMEs, you're finding just an increasing exposure on an individual basis.
So let's just rewind a bit and just get some terminology right. So can you talk through what is an outbreak, what is an epidemic, and what is a pandemic?
Yeah. What I'm going to say is even the World Health Organization recognises that these terms are actually used somewhat colloquially.
Sure.
But an outbreak is a small outbreak of a recognised disease. An example of that is where there are various religious groups who've refused to have their children vaccinated. You will find an outbreak of measles actually happening within that group. An epidemic is a large growth in the number of cases over and above the normal expectation. But the epidemic will usually be a known disease. And again, we are seeing a measles epidemic actually much more in certain parts of the world where this has actually happened. A pandemic is usually defined as a new virus, so a disease not previously seen that is now actually gone from a single epidemic in a single country to multiple epidemics in multiple countries.
And this is nothing new. I mean, this is throughout the course of human history. How does what we're facing today compare to pandemics of the past?
Well, I think if you look at the Black Death.
Right, so we're starting with some really upbeat comparisons here.
And also, I mean, what better name than the Black Death to strike fear into your heart, really, Liam? So the Black Death lasted from 1345 to 1353. It was estimated to have wiped out a third of the population of Western Europe at that time. It's unimaginable compared to today.
And that's bubonic plague. Is that something that could re-strike in this day and age?
I don't think it would actually, because we'll go into perhaps others that have actually restruck. In fact, let's talk about them now whilst you've raised the subject, Liam. If you look at Ebola virus, we continue to see outbreaks of that.
Yeah.
Those outbreaks have now happened over 30 years, where we do get fresh outbreaks. There are various subtypes of the virus. So we do actually continue to see various diseases actually returning. But I think there's just two other that I really want to talk about to compare and contrast. You look at Spanish flu, which struck in 1918 to 1919. Spanish flu killed more people than the First World War, the Second World War, the Korean War, the Vietnam War combined.
Wow.
To put it into perspective. It killed people as well in the 20 to 40 age group with a great facility that you don't usually see.
And why is that? Do we know why that is?
We don't really, and they have even actually sent expeditions up into the tundra, into the permafrost, to try and actually exhume bodies who are buried there so that we can actually study the genetic sequence, the DNA sequence of the Spanish flu virus. I should point out throughout, there is often as much that is not known as is known, even about diseases of the past, let alone today. The last one I want to contrast it with was actually the swine flu epidemic of 2009. Again, that was termed as a pandemic because it met the actual definition in terms of its spread. But it was a relatively benign disease in terms of its fatality rate. But we still shouldn't forget the worldwide fatality rate was estimated at 490,000 people. But it was relatively benign in terms of death rates in many countries. And I think if you look at the potential disruption to society that we're seeing now compared to 2009, its economic consequences were not nearly as severe.
And why is that? Why is it a bigger issue today, certainly for us here in the UK, far more headlines today about coronavirus than there was with SARS, with swine flu, etc.? Why is that?
I think there's the real and the imagined, Liam. What is the real is really the complexity of global supply chains that we've actually just discussed. We are now a globally interdependent community, really, with those. I think the other thing that compounds it is lean manufacturer. Whereas beforehand, suppliers, say car makers, would have stockpiled all production materials perhaps for a 2 or 3 month period. Now they will actually only stockpile literally sometimes on the day, but no more than a week. So it leaves people more exposed to it. The other key factor, which you described in your introduction, is the infodemic. And I think infodemic is driving a set of behaviours that are actually disproportionate to the risk posed to that individual.
So, I mean, I've been sent WhatsApp pictures of bat soup and pictures of pigs being pushed into a pit and all of this stuff from supposed content from China. It's very difficult to know what's real and what's true, but surely people are still getting their main advice from public health officials or not?
Well, as an occupational physician, I'd love to feel so, but I suspect the reality is not. I mean, I have seen virtually all of the rumours and conspiracy theories, and some of them, quite frankly, beg a belief. How any sane or reasonable person can give them credence. But they do, and I think people then tend to trust what they see on their social network, groups that they actually liaise with. There was a viral research laboratory in Wuhan, which is a somewhat unfortunate coincidence.
Yeah.
But again, the rumours that have been associated with that, I don't think it has been helped when countries suppress information, particularly at the onset.
So like Iran, for example.
Iran and also China, it must be said, because what that then does is detract from trust in any subsequent statements that actually have complete probity attached to them. That's the real and the imaginary. The real is the supply chains. The imaginary is this huge amount of misinformation that has actually sprung from that.
Getting down to practicalities for businesses here in the UK that are facing real disruption today. And let's also just try to bring this slightly into the more general, to talk about epidemics and pandemics in the abstract. What should businesses be doing to face this risk?
2 words, think ahead. I think if history has taught us anything from 2002 SARS, 2009 swine flu, 2012 MERS-CoV, and now this, these are an inevitability, much as storms, hurricanes, adverse weather events. You cannot prepare for every eventuality, but you can prepare to react to a series of predictable eventualities. And I think one of the key areas I find advising businesses is that their business continuity plans only focus upon their own activity, but they absolutely fail to take into account all the interdependencies that they form. If the person who opens up the office key each day can't get to work because there aren't enough train drivers to supply public transport, how will you get on? So I think it's thinking much more
systemically almost.
Yeah. And I've certainly run pandemic simulation exercises for organisations. And it really helps them to think about what are the broader interdependencies they've got to think about, rather than just the focus on their own line of business.
So in terms of this theme of thinking ahead, and actually there will be businesses, I imagine, who will learn some really hard lessons over this year in terms of how they respond to the current outbreak. What would be some of the key touch points that you would go to in terms of this is what a business can do to prepare for the next pandemic?
I think it's about having resilience in their supply chains. I think it's having thought through If you're running large call centres, how are you actually going to deal with emergent cases in that call centre? At what point are you actually going to close down that call centre? Have you got resilience to transfer it to other call centres? As I said at the start, Liam, I think there's no one single panacea, but it's thinking about a range of sensible options that will help you to prepare.
One thing that I wonder, Mark, is does this outbreak in the UK mark a little bit of a revolution in home working? So we've seen a big transition to home working for a while, but this whole pandemic has led people to start having to work at home, either because they're self-isolating or because they actually have coronavirus, and actually having the ability in many jobs to have that flexibility and to shift workers to home wherever possible. I wonder if that might be a lesson for businesses going forwards.
I give a qualified yes to that. I mean, you think how many people are privileged enough to have a job that allows them to actually work at home. I don't know what proportion of the working population it is, but I'd still imagine it's a relatively small proportion of the working population. Schools need to go on, deliveries still need to happen, supermarkets need to work. So it's only a relatively small proportion of people who can actually undertake it. If it actually tips us into thinking about all of the people who could be working at home should be working at home more often, then that's got to be good for the environment in terms of lessening travel dependencies. I think one of the other things that might hopefully happen from this, and compared to all the recent environment and climate change publicity, is companies will look at their travel policies and actually look at reducing unnecessary travel in the longer term.
Let's talk about sort of workforce insecurity. You touched on it earlier, and whether it's the gig economy or whether it's very short sick pay periods, there's going to be a big impact here on a lot of people's personal finances.
Undoubtedly. I think it's going to be a reflection of how many companies are going to be impacted in subtle ways that aren't always actually obvious. Individuals, the self-employed, those in the gig economy are going to find themselves hit the hardest. They're the people most likely to continue working whilst they're infectious, but with the milder symptoms of the disease at its starting point. They're the people who are more likely to return to work as soon as they feel able, even though there's evidence of virus shedding even when you're symptomatically improved. So you've got people who are going to be infectious and working before they have to go off sick, and then potentially still infectious and returning to the workforce afterwards. That's just not good business for anyone. I think it's ironic when we look at things like the Black Death, Spanish flu. At the present time, we're never better prepared to actually deal with and manage the impacts of a pandemic, whilst perversely at the same time we've never been more exposed to the consequences of it. How are we better prepared? I think the speed, even actually compared to 2002, if you think at that time the human genome had just been sequenced for the first time, the speed now with which we can actually DNA sequence all the viral makeup, we can actually continue to do this to look at any viral mutations. We can actually put drugs and vaccines, tailored vaccines designed on the basis of DNA sequencing, into rapid production. All of these things are great, but I think even this coronavirus has actually shown us, even compared to 10, 20 years ago, how much more globally we are exposed as an interconnected economy and suffering both the individual and the corporate consequences of it. It's perverse, really, isn't it?
It is. And one thing that strikes me, which is perhaps part of that perversity, is for all that technology and obviously focus on vaccines and DNA sequencing, etc., the main bit of advice that can be given is wash your hands well. And I just wonder to what extent that bit of advice should be adhered to more generally rather than just when there's an outbreak.
Well, absolutely. I mean, people who have a flu jab forget that the seasonal flu is here every single year, year in, year out. Obviously, winter in the northern hemisphere, and then in our summer months in the southern hemisphere. So it is here the whole time, omnipresent, and so these are just good hygiene practices. When I was a GP many years ago, Clearly, the nursing homes always feared an outbreak of flu because an outbreak of flu in a nursing home would actually have significant consequences on illness and even death. The other thing that's unusual in this latest outbreak is that usually influenza outbreaks impact on the youngest and the most elderly in society, whereas the coronavirus is very much focused on the more elderly in terms of the death rates, not the infection rates.
And people with underlying health conditions.
Exactly, yes. So, particularly heart disease, diabetes and chronic respiratory disease have got much higher case fatality rates than those who are otherwise healthy.
So, Mark, let's wrap this up. We're in the middle of an outbreak here in the UK. By the time people are downloading this podcast, the whole game will have changed and moved on. But are there key lessons that we can take already from what's happened that HR people and business leaders can take on board to prepare their businesses better?
I think there are three key things we can actually take away from this. Having business continuity plans in place beforehand. Secondly, and this is probably the even more key things, is actually have tabletop or real-life testing scenarios of those business plans. Having them just sitting there as a series of theories that you think will help you cope is usually divorced from practice. And thirdly is actually stay calm, have clear messages, communicate them consistently to all of your staff on a regular basis.
And where should business leaders be getting their advice from?
They should be getting it from reliable sources, such as their occupational health provider. There is so much misinformation. People in business need two things. They need clear health advice, but the key part of the occupational health provision is making sure that that health advice is tailored to the operation and the effective operation of their business during such crises.
Mark, thank you. I hope you're well bunkered down with tinned goods, ready for this to go further into daily life, and hopefully I'll see you the other side of this outbreak.
Thanks, Liam. Bye for now.
Look out for the next episode of Talking Work and Health, where we'll be discussing social media and the impact on mental health. Talking Work and Health is brought to you by Health Management and Maximus Company. Please visit our site to find more about occupational health at healthmanagement.co.uk. Please remember to subscribe on Apple Podcasts, Spotify, or wherever you download your podcasts for more interesting episodes.